This is Bufo toad toxicity, presented by Carley and Carley. What is a bufo toad, you ask? Well, it is a land-dwelling carnivorous toad, contrary to its name, Bufo marinus. It is also known by cane toad or marine toad, and it is a species that has been introduced to islands and is invasive. It's commonly used for pest control in South America or in Central America, and its most common predator, so you guessed it, canines are a common predator of the bufo toad. Along with being used to control pests and crops, the toad's milky secretions have also been used by tribal groups in South and Central America to coat poison darts or arrows, and it has also been used as a narcotic. The bufos have a special gland pictured in the photo to the right of the slide. So pet owners, be wary of letting your pets outdoors unsupervised if you see creatures that look like this. Alright, so now that we know a little bit more about bufo toads in general, let's move on to how it can affect our common household pets. Mainly dogs and cats, but it has also been known to affect ferrets too. Because they are land-dwelling bufots, they become easy targets. The absolute worst thing your pet can do if it encounters a bufo toad is put the toad in its mouth. The active compounds that the toad secretes are rapidly absorbed in mucous membranes such as gums and eyes, which can result in severe toxicosis of an animal that happens to put it in its mouth. The toxin will enter systemic circulation and can affect the animal greatly. The biologically active compounds that are released from these animals include dopamine, norepinephrine, epinephrine, serotonin, and several other toxins. There are several things that you want to consider if your pet were to ever encounter a cane toad, especially if you live in more or mild climates like Florida, for instance. The most common household pets that are affected would be dogs and also cats. But dogs are more likely to lick or pick them up in their mouth, which would have more adverse reactions. Bufo toads hibernate in the winter, so another thing to be cautious of is if you're letting your pet outside in the hot summer months to watch for signs when they come back indoors. Some common signs that you would want to watch for would be hypersalivation, vomiting, bright brick red gums. So get familiar with the actual appearance of what normal gum tissue would look like. If signs persist, neurological disorders can erupt, and some of those would be seizures, rapid eye movement, muscle rigidity, abnormal balance, stupor, and more serious cases can be coma. Some other common, more chronic signs that can develop would be rapid breathing, trouble walking, cardiac irregularities, weakness, collapse. You can also have pulmonary edema, convulsions, diarrhea, depression, and death is often common within 30 minutes of exposure. So it's a pretty serious toxicosis. So now that we're in the middle of this presentation, here's a fun little checkpoint to kind of review some of the stuff we were talking about earlier in the presentation. Our first question is, what is one of the most common signs to look for if your pet were to encounter a bufo? Well, some of the most common signs, like we mentioned earlier, are brick red gums, hypersalivation, and vomiting. But also there are some other signs that can persist too. So if you answered, diarrhea or anything like that, you are also correct. Which household pet is commonly affected by the bufo toad? Dogs are more commonly affected by bufo toads because they're more likely to pick them up in their mouth. Assuming your pet actually encountered a bufo toad, some treatment options before you were to visit a veterinarian's office that you could quickly do at home would be to get a running hose and rinse the inside of your pet's mouth with the water, with your animal facing downward so the water isn't swallowed or aspirated. You want to make sure to rub the gums and massage them to remove any immediate toxin that might still be in their mouth that hasn't been absorbed. and it just minimizes absorption period. After that, I would rush your pet to the nearest emergency veterinary hospital or clinic because they will probably require more extensive therapy, such as seizure intervention, medication that could stabilize, arrhythmias, and other supportive care, especially if they're pretty badly debilitated. If your pet were to encounter a Bufo toad, there is good news. The survival rate for an affected dog that's suffering from an intoxication by a Bufo marinus toad is as low as 4% with proper treatment. For more information, feel free to visit any of these websites to gain more knowledge about Bufo toads and Bufo intoxication. Thank you for listening. Have a good one.